Did you hear the machine? That's it. Right?
Grady Hospital is one of the largest hospitals of its type in the country. It's a county hospital originally built to take care of the indigent poor of the two counties of Fulton and DeKalb. Over the years, it has changed in its thrust and its direction, and although it still cares for the indigent poor of these two counties, its available means to deliver medical care will stretch from the simplest suturing of a laceration, a cut, all the way to care of the patient with a chronic illness such as chronic renal disease, who may need a kidney transplant or whose blood may need to be purified twice a week. So that we go from the very simple to the very complex types of health care within the walls of this hospital. We see and admit about 30,000 patients a year to the hospital. On an outpatient basis, on an ambulatory care basis, approximately 550,000 patients are seen, much as one would be seen in a private doctor's office on a one-to-one relationship. This includes emergency room visits. The patients that we care for at Grady range from the very poor to the man who's stricken with a heart attack at the stadium and is brought here. We have the capability of dealing with the wide variety of situations that any general hospital may be faced with. But in addition, we have the capability of dealing with virtually any emergency, which I think is one reason why the Grady Emergency Room is such a busy one.
Here at Grady, we have 8 ambulances that are used for emergency calls. We run at one time during the day, we might have 6 vehicles running, have a couple of spares. All ambulances are equipped with oxygen, backboards, splints, and things that you'd need in an emergency, such as bandages, suction machines that can be used for any type of emergency where suction is needed. We're answering around 100 to 105 calls a day. And for 1970, we've had around 36,000 ambulance calls. And the wait, I'd say a person never have to wait over 8 to 10 minutes for an ambulance. If a Grady receives a call, a lot of times people on the scene think 5 minutes seems like an hour. We're supposed to abide by all speed limits, but driving an ambulance is like driving a fire truck. You can't always do it. They try to use a lot of defensive driving and arrive on the scene as quick as they can with what emergency equipment they have. We advise none of them to go through a red light unless he stops and then proceed. Once in a while, you can't make an emergency call without running over the speed limit. If you did, we'd have a lot more criticism than we are having.
I'm working here at Grady in the surgical department, and it is a large teaching institution with many patients that are treated throughout the year. Most of them come in with traumatic injuries such as gunshot wounds and stabbings. I feel that they get adequate nursing and medical coverage. The nurses are busy because of the patients that they are taking care of, but they are never, they never have a period of time where they have too many patients to take care of. We are starting to do something here to make the person become more knowledgeable of their disease and following them while they are in the hospital and teaching them medically about their problems, and hoping that when they leave here, because of this knowledge, they will be better able to take care of themselves.
In 1971, our budget has increased from $27 million to $33 million. This is a whopping increase. We must find ways to finance it. The counties, which traditionally support agencies such as Grady or cities, have had the same problem of financing their care that Grady is seeing. Where will the money come from other than ad valorem taxes to support our programs and our agencies? We have had needs for additional beds, and in 1971 we have projected the opening of 2 additional wards at Grady, one for the medical service and one for the surgical service, but they must be financed. Grady was planned with the future in mind, and we should certainly congratulate the people before us for thinking of this. We have been able, during the 13 years that we've been in this building, to open additional beds and facilities as they were needed. And so we are able to face the future with this particular problem because it was built with the future in mind.
Lift it back up again. Get it even with the right hand. Now close your eyes again and keep them that way. Keep them even. Let me just get up and walk over to the door. All right, sir. I'll be right here by your side in case you are weak. There's no doubt that specialists have been on the increase and general practitioners have been on the decline, especially in a large metropolitan area such as Atlanta, probably since, I guess, World War II. I think that in many cases, such as mine, that people find in medical school a subject, in my case, neurology, that consumingly interests them, and that you just feel that you're not content with knowing the small amount that you would of necessity learn about it were you to become a general practitioner, and that you just have this desire to learn much more about this particular area. Now, as to whether or not there is a halo surrounding a specialist, that may well be true in a large university center and in a large metropolitan area where this is the name of the game. But when I go to my hometown, for example, which is a small town in East Georgia, there are of about 4,000 or 5,000 people, a specialist up there would starve. And you know, the halo is around the general practitioners, the people who have known, the physicians who have known the people there for many years. And you know, you can go to one of these people and talk to him about a particular lady. Sometimes when I go home, I'll be asked a question or two about a particular kind of illness. And the general practitioners can tell you, well, I've known this family now for 40 years, and they tend to have these problems. One of the problems that we have here at Grady so often is in distinguishing between organic illness and psychiatric illness, especially in certain areas where the two have an interface that's very difficult to separate. And these general practitioners can do things like that without even turning a hair.
Okay, dear.
In Atlanta, we've taken some innovative steps which have been followed around the country. For example, the Southside Comprehensive Health Center, which is a federally sponsored demonstration project about how comprehensive health care can be delivered, is a demonstration project which is staffed by Emory University faculty and by people from the community in an effort to have an economic and social impact on that community as well as impact on the medical care of the community. They take people from that area of town and train them in health care so that they can help in delivering their own health care. They are entirely outpatient, have no facilities for inpatient, nor for some highly specialized types of care that are needed and available, for example, at Grady. So in order to accomplish this, we have made liaison with them. There is a liaison office here staffed by nurses, clerks, secretaries, and by a physician who spends half her time here and half her time at the center. Then, of course, outside this more elaborate structure, the Fulton and DeKalb County health departments, which have been in existence for a long, long time, and which are primarily interested in preventive medicine, well baby care, prenatal visits, women about to deliver babies or during the course of their pregnancy, such things as venereal disease, tuberculosis. These sort of public health problems are being approached, and we have made some liaison with these two county agencies in an attempt to make healthcare delivery more continuous for the patient. And then thirdly, there are a number of volunteer clinics staffed by volunteer people, doctors and nurses, some from the private sector of medicine, some from Emory University. Many of the doctors work both at Grady and out of these volunteer clinics, which, for example, may meet once a week. And at Grady, we have made arrangements so that if a sick patient is detected out there, they can be seen at Grady for more definitive care or prolonged care should this become necessary. So in an effort
That way. Times.
you could do. We had a lot